I have the distinct honor and pleasure of introducing our in-person welcoming presenter. He received his medical degree from the UVA in 1996 and returned in 2011 to earn his MBA from the University of Virginia Darden School of Business. He is board certified in family medicine as well as addiction medicine and was named the 2011 Family Physician of the Year for his innovative work in the primary care of treatment of addiction and chronic pain, and for his leadership in recruiting healthcare professionals to what was once considered a medically underserved county. In April 2018, he was appointed the Commissioner of the Department by Governor Ralph Northam to lead the agency in transforming Virginia's system for people with behavioral health and developmental disabilities. Previously, he served as the Chief Deputy Commissioner of Public Health in preparation for the Virginia Department of Health. There he led a highly skilled team that directed the activities of 8 offices, 480 staff, and managed a budget of $185 million. Prior to that, he was the Vice President of Medical Education for the Northeast and Northwestern markets of a nonprofit organization known as Mountain States. There he started 2 residency programs and enhanced other medical programs to address the workforce shortage issues. His steady leadership led to his team being awarded the President's Quality Award and he receiving the Service Heart Award, the highest patient service award granted at that organization. Ladies and gentlemen, please give a warm welcome to a leader, teacher, and healer, Dr. S. Hughes Melton.
Thanks, Malcolm. And what Dr. Rao said is right, that VCU is a leader in this space. And I was talking earlier with Dr. Dick about when I was in medical school, they told us, on average, it takes about 10 years for what they discover in the research space to make it to the front lines where many of you practice and impact the individuals that you're treating. And that was always felt like a tragedy to me that it takes so long. And we were talking about how it's events like this that can shorten that time frame between what we're finding in the research space and how we actually turn that and we translate that into work that's being done at the front line. So thank you for coming today. And again, it's very important. This is our 4th year, 3 years up until, and this is our 4th year. And I've already spoken with a number of folks who were here yesterday that the speakers have been excellent. And in looking at the schedule for today, looks like it's going to be another great session. I wanted to talk a little bit today about the uniqueness of the youth and the situations that they're in. Talk a little bit about some of the gaps and the dollars coming in to try and address those gaps in treatment, and then talk specifically about some of the work that we're doing. But before we do that, I have to confess that whenever I think about youth and addiction, I get kind of sad, because when I was in practice, before I came to Richmond, I served in Southwest Virginia as a family doc, and started in 2000 after coming out of the military, and very quickly saw that I was ill-equipped to deal with the conditions and the issues that patients were presenting in my clinic with. And so within a year or so, sought additional training, tried to become involved in the treatment space to try and be part of the solution. And one of the patients that I treated was a 20-year-old, we'll call him Jim, and he went to the same church that I went to. His parents were friends of mine, and he had a very long history of substance abuse, all the way back when he was 14. And got him into treatment, did very well, got into recovery, had a child, and then unfortunately relapsed and had a fatal overdose. And I think that speaks to the challenge we have in treating the youth and the, I think, disproportionate impact that substance use and misuse has on our youth. And I think just makes it that much more important that we focus on that issue and that we invest in that issue. So some of the gaps that we've talked about, we estimate there's about 488,000, almost 500,000 Virginians of all ages who don't get the treatment that they need for addiction. And of those, the 18 to 25-year-old group represents about 120,000. I mean, it's a lot of individuals. And the challenges associated with that group, they're unique because their brain is in a unique developmental stage, number one. Number two, they're naturally withdrawing away from their traditional supports and finding their own path in life, so they're vulnerable. And then we also find that they have a unique way of discovering old drugs that have sort of gotten off the radar in the mainstream, like LSD and amphetamines in the 60s. They get rediscovered. The mainstream society has moved on to other issues, and the youth sort of come behind. And they aren't prominent. And all of a sudden, sometimes the treatment community gets surprised a little bit by what is it that our youth are using and experimenting with. And so it makes it particularly challenging to treat the population. It is a priority for not just Governor Northam, but the federal government. We have seen a fair amount of dollars come into the treatment space to try and address some of the gaps. So the YSAT program, who here works with the YSAT program? I know some, yeah, exactly, some hands. So that's about $3.2 million that have come in through the agency and then back out into the communities, to the community service boards and other treatment providers in the state. We also have the almost $33 million from the federal government through the SDR grant and the SOAR funding when you add it up over a 3-year period. That, of course, is treating all different, being used in all different aspects of treating addiction. When we think about treating addiction, we think about prevention, treatment, and harm reduction, and those dollars are going into all of those different spaces. Another area that we're focusing on is trying to move upstream. So certainly we have to have treatment for individuals who already have the disease of addiction, who have a substance use disorder. And I had a chance to visit with a couple of the sponsors who are here that are providing that treatment that really wasn't available to Jim when he was 14, or at least we weren't aware of it. His family wasn't aware of it in rural Southwest Virginia, and could have made a difference, right? But if you can move upstream and identify those events in community and situations in the environment that are causing ACEs, adverse childhood events or experiences, and the understanding of that those exist, that they have a significant impact on the individual who experiences them, not just at the time that they experience it, but also down the road as a major risk factor for developing addiction as well as other mental health disorders. Understanding what are ACEs and how is it that we come together as a community, because they really have to be addressed at the ground level in community, is a significant component of trying to educate communities to try and prevent those types of experiences that our youth have, that then set them up to be more likely to develop addiction. One of the challenges with the dollars, and I'll just leave you with this thought, is that you never really know how long federal funds are going to last, right? So right now it is a major priority of the not just the state governments and you, but also the federal government. But as often that wave will pass, right? And so we're using the dollars to try and set up and establish groups and relationships and institutions that then can continue past, can sustain past when those dollars start to get directed elsewhere. And I would just say that the gathering that you have here is an example of that. Bringing different, I was talking with Malcolm actually earlier about if just one organization tries to do an event, it's much harder to draw the kinds of speakers that you're able to draw yesterday and today. And so collaboration, bringing together different organizations, individuals in different places in the continuum from research to recovery, not only help to build relationships and share ideas amongst yourself, but it also enables you to bring in speakers from around the state who have information that you can then take back to your organizations that you come from and share those ideas. So, with that thought, addiction is a treatable disease, and it's a chronic relapsing disease of the brain, and recovery and a productive life is possible for people who have it. And you know that better than I do because many of you are interacting and treating individuals on a daily basis who have that challenge. And thank you for the work that you do. Thank you for your partnership with the Department of Behavioral Health and Developmental Services. And I wish you the best in the rest of your time today.